So what is preeclampsia? Pre-eclampsia is a condition that usually develops in the second half of your pregnancy and involves the placenta. Basically, when the oxygen passes through the placenta into your baby's blood supply, that is diminished, which means that less oxygen gets through. We don't really know why that happens, but that develops a condition in yourself called pre-eclampsia. It is not a condition that comes up all that often. Around about 6% of women have the milder form of pre-eclampsia in their pregnancy, whereas 1 to 2% of women have the more severe form. So there are a few risk factors that make it more likely that you may suffer from pre-eclampsia during your pregnancy. These include high blood pressure, diabetes, kidney disease, being overweight or having been overweight in the past, and also a family history. If your mum or your sister have suffered from pre-eclampsia themselves, there is a greater chance that you would suffer from it too. So keep your eye out. So there are a couple more risk factors that you need to bear in mind. If you suffer from lupus or antiphospholipid syndrome, that can mean that you're at greater risk from suffering during your pregnancy. And also if you've had preeclampsia in the past. If you have suffered from preeclampsia in the past, make sure you tell your community midwife that you have. What are the signs and symptoms of preeclampsia that you need to be aware of? The biggest two are high blood pressure and protein in your urine. But luckily, every time you go and see your community midwife, she'll be checking both of those things. If she finds them, then she'll probably send you in for some blood tests at the hospital. Between your antenatal appointments, it's really important that you keep an eye out for other symptoms as well, such as having headaches and visual disturbances, so zigzags or flashing in front of your eyes or blind spots. If you have pain in the middle of your tummy, and also if you start to swell around your face, neck, hands and feet. Swelling of your hands and feet is really common in the summer months, so don't panic if that happens to you, but make sure that you let someone know if you feel any other symptoms alongside that. It's also worth mentioning if you have a lot of unexpected weight gain, that can also be a sign of preeclampsia, so make sure that you mention that to your midwife at the first opportunity. So, could it harm your baby? Ultimately, you need to be on top of your symptoms, and every time you go to see your midwife, they will be checking for this too. However, if it goes untreated, it can be harmful, so please don't delay if you're concerned with your symptoms. So if they do think you're suffering from preeclampsia, they may well send you into hospital. This is to make sure that they can keep an eye on you and your baby and get you the medication you need to keep you healthy during the remainder of your pregnancy. If you are officially diagnosed, then you will be monitored quite heavily during the rest of your pregnancy, but that is to make sure that your baby stays safe and you as well. So what can you do to treat preeclampsia? Ultimately, the only way to get rid of it is to deliver your baby. If you are diagnosed, the chances are you will be sent to hospital and you'll stay there until it's safe to deliver your baby. In moderate cases, it can be possible to be treated from home as well. You will have those blood pressure tablets most likely, but this will include extra ultrasound scans as well. The purpose of these are to measure the blood flow from you to your baby to make sure it is staying at a safe level. If this changes, then the plan changes, and it may mean that they need to get your birth further forward, either by caesarean section or by a natural birth. It is also worth mentioning that you can develop preeclampsia after the birth of your baby, so make sure that if you've given birth and you go home and you experience any of the symptoms I've mentioned, that you get in touch with your community midwife straight away. In very, very rare cases, it can develop into something more serious called eclampsia or HELLP syndrome. These conditions are very rare, and usually preeclampsia stays as just that. However, it gives you a bit extra motivation to keep on top of your antenatal appointments to make sure that your blood pressure and your urine is fine. For more support, you can get in touch with the Mumsnet talk boards, which is 24 hours a day, or you can get in touch with Action on Preeclampsia for some more advice. See the link in the description for more information about preeclampsia, eclampsia and HELLP syndrome as well. Don't forget to subscribe to the Mumsnet YouTube channel and like our videos for more information, and also to keep your eye out for more pregnancy videos which are on the way.